Hello, I'm Dr. Eric Garfinkel.
And I'm Dr. Barbara Gluckin.
We are psychologists specializing in mental health care for the elderly. This video talks about some of the emotional issues that are common among the elderly and provides real-life examples of 3 common conditions: anxiety, depression, and pseudodementia.
In addition to this video, there is a free guidebook called You're Never Too Old to Feel Good that can help you identify how you're feeling and what you can do to get help.
Reading the guide and then watching these video examples should help you to recognize and understand some of the commonly occurring conditions in an elderly person. The goal of this video and the guidebook is to help you take control and feel better. Remember, you are never too old to feel good. Sometimes when people feel anxious or depressed, they act out angrily. To illustrate this point, let's observe Miss Smith telling her psychologist about events going on in her life.
I don't like the people living here. I wish I could go back to my home. I know I can't take care of myself anymore. Nobody likes me. They say I'm too angry. Well, I am angry. I wish things could be like they used to be.
How did they used to be?
As you can see, Ms. Smith is feeling angry and agitated. However, beneath the surface, she's probably feeling anxious and depressed about her loss of control, loss of independence, loss of former roles, and possibly her diagnosis of diabetes. This is not unusual for an older adult who is going through a lot of changes in his or her life. With someone like this, the first step may be to find out if the living situation could be changed. Could Ms. Smith go home? Could her living environment be changed to put her more in control? If the situation cannot be changed, or if that is not the cause of the problem, talking to a licensed professional can be a good start to get help and take control of the situation. For some, medication is the right choice. If this sounds like how you are feeling, it's important to know that a lot of people go through the same thing. Many older adults are now getting help to feel better. Proper treatment can help identify causes of anxiety, persistent sadness, or anger, and give you the tools to overcome them. Remember, you have the power to feel better. You can take control of your own care.
Sometimes people who are anxious avoid situations that make them nervous. This can make them very isolated. Let's watch Mr. Kelly as he speaks to a psychologist about why he has not been going to his usual activities.
How have you been doing? I hear you haven't been getting around as much anymore.
I used to attend more activities. I haven't been leaving the floor as often as I used to. I'm more comfortable just staying here.
So you've been sticking on this floor and not going to the activities or to recreation or to any of the things that you used to like to do.
Right. Lately, I'm not so sure of myself.
Mr. Kelly is clearly anxious about traveling independently to activities. This is common among older folks, though it is often not talked about. With treatment, he can be helped to feel less worried and more confident when traveling to recreation programs. A psychologist or other licensed professional could provide support and teach him coping skills to better manage his anxiety when it does appear. If you notice that you have been avoiding pleasurable events or are becoming isolated, you can get treatment that will help you resume activities that you used to enjoy, interact with others more, and have a better quality of life. Here are some treatment options. If your emotional problems stem from a medical condition, you can seek treatment. Your doctor can perform tests to determine whether you are suffering from any medical problems. If so, your doctor can treat them. In this case, resolution of a medical condition will likely make you feel better. If there is no underlying medical condition, you may want to seek the help of a psychologist or other licensed mental health professional. He or she can help you determine why you're feeling the way you do and work with you to feel better. Nowadays, many older adults like you find this to be very helpful. If psychological treatment does not fully help, You might want to look into the many drug treatments now available for people who want to feel less anxiety, unhappiness, or sadness. You can discuss the different therapies with your physician. You might want to explore which ones are best for you, potential side effects, and when you can expect to see results. Remember, you have the power to feel better. You can take control of your own care.
Ms. White is suffering from pseudo-dementia. Let's watch as Dr. Gluckin interviews Ms. White, discovering that Ms. White's problem is not dementia, which is generally not responsive to treatment, but pseudo-dementia, which is readily treatable.
Thank you for being able to see me. I think I'm losing my mind.
I can see you're very upset about this. Why do you think you're losing your mind?
I can't seem to remember anything lately. I always had such a good memory before. Last night I went into the bedroom. I couldn't remember why I was there. Do I have Alzheimer's?
There are a lot of reasons people become forgetful. How has your sleep been lately?
After I retired a few months ago, I was still getting up at 7 out of habit. Recently, I've been waking up at 5 for no reason.
During the interview, Dr. Gluckin discovered that Ms. White's behavior had changed after the death of her husband. She was not sleeping well or eating normally, and she was feeling depressed.
I suspect that your memory problems might be related to your mood. You've had some big changes this year, and I can see how sad you've been feeling. Your sleep and appetite have worsened, and you're not doing the activities that you used to enjoy.
Sometimes when people are depressed, their memories can be affected, and this effect on memory can be mistaken as dementia. The first thing to do in this case would be to talk to your doctor about performing medical tests to rule out any physical causes of the memory changes. It is important to make sure to talk to your doctor about how you are feeling both emotionally and physically so that he or she can make a good evaluation and help you. Remember that many people go through similar circumstances. In addition to medical tests, you might want to talk to your doctor about arranging for a neuropsychological evaluation to better understand the changes you are experiencing with thinking skills like memory, attention, reasoning, etc. Once you and your doctor have all of that information, it will be easier to make a good diagnosis so that you can work with your doctor on feeling better.
But what if it turns out that I'm depressed? What can I do about my memory?
In that case, we could treat your depression with psychotherapy, medication, or a combination of both. Memory problems caused by depression are reversible. Many people like you are getting treatment and now they're living happier lives.
The most important thing to remember is that you are not alone. Many people, the elderly included, suffer from anxiety and other mental health issues. Many of these people are also now getting successful treatment. It is up to you to take the first steps if you think you need help. We think you'll be glad you did.
If you would like more information, please see our guidebook, Never Too Old to Feel Good, which is available for free from our website, www.ltccc.org, and at many nursing homes, assisted living, and senior centers.
Remember, you have the power to feel better.
You can take control of your own care.